Hi students, we are going to see the fast revision of the abdomen, and if you see this is the front part. So this is the female pelvis. You can see the female external genitalia. So if you go inside, you can see the first organ, that is your bladder. Okay, you can see that, you can see the bladder, you can see the cavity of the bladder. So this is the bladder, first organ. Number 2, when you reflect the bladder, you can see nicely the uterus. This is the fundus of the uterus, and this is the body of the uterus, and this is the cervical part of the uterus. And here you can see a pouch, nice pouch. It is called as vesico-uterine pouch. Vesico means bladder, and this is a uterus, so it is called as vesico-uterine pouch. And if you see the pouch, you can see nicely the tubes are going from here. So this is your fallopian tube, and if you see that this is the one which got cut, this must be the anteriorly it is coming, so this must be the round ligament of the uterus. So this is the round ligament of the uterus, and next you see that you have a broad structure which is going from here to here, that is called as broad ligament, from the body to the pelvic wall. This is a false ligament, that is called broad ligament. And if behind, if you see that, you could see the ovary. Can you see the ovary? Yeah, this is the part which is called as meso-ovarium. This is the part which is called as mesosalpinx. So mesosalpinx, meso-ovarium, and the rest is called as mesometrium. 3 parts. These 3 are the parts of the broad ligament. So which is holding the part which is adherent to the tube, that is called mesosalpinx, which is holding the ovary, that is called as meso-ovarium, and the rest of the part which is adherent here is called as mesometrium. These 3 are the parts of the broad ligament. And if you see the contents inside the broad ligament, first you should write the uterine artery. Behind the uterine artery, antero superior to the uterine, postero superior to the uterine artery, you have the ureter. So ureter uterine artery relationship is very important. Bridge above and the water below. The bridge is your uterine artery and the water is your ureter. Then if you go down near the cervix also, 2 centimeters from the cervix, the lateral fornix of the cervix, you have again the same relationship, uterine artery and the ureter. So that is an MCQ. Then if you come here, round ligament attachment is angle of the uterus or cornu of the uterus. This cornu is where the fallopian tube, it meets the body. That area is called cornu of the uterus. From the cornu of the uterus to the labium majora, this is the attachment of the round ligament of the uterus. This is a remnant of the gubernaculum. Then if you see, this is ovary, right? So the ovary, the angle to the ovary, that is called as ligament of ovary. Angle to the ovary, it is called as ligament of ovary. From here, from the upper pole of the ovary to the pelvic side wall, it is called as infundibulopelvic ligament or suspensory ligament of the ovary. So 2 ligaments for the ovary, one is called ligament of ovary, another one is called suspensory ligament of ovary, which is coming from the pelvic side wall. So you can see the ovary here clearly, you can see the ligament of ovary from here, and then anteriorly you have the round ligament of uterus, and then the supports the true ligaments and false ligaments. False ligaments are from the uterus to the uterus to the bladder, it is called vesico-uterine or vesico-uterine fold, and behind that you have the rectum. You can see the rectum, right? So between the rectum and the vagina, the fold is called as recto-vaginal fold. And the third false ligament is your broad ligament, just now we discussed. So contents of broad ligament, when you discuss, you should write uterine artery, ureter, paraophoras and epiophoras, and the ligaments, this ligament of ovary and the round ligament of uterus. The paraophoras and epiophoras are the remnants of the mesonephric duct. Mesonephric duct is nothing but the duct from where the male reproductive organs are being formed. And then next, this is the pouch called recto-uterine pouch. This is the most dependent area, because when you reflect the peritoneum from the anterior abdominal wall, it goes above the bladder and then it goes up to the body of the uterus here. So the pouch here is very shallow, but when it goes back, it goes so deep inside the cervix, and then it comes up to the rectum. That's why this area is very deep. This is the most dependent part in the female pelvis, and if there is any free fluid collection here, it means that ovulation has occurred. So this is about the pouch. Can you see? It's seen clearly. This is your rectum, this is the uterus, this is a pouch called rectouterine pouch. And then fallopian tube parts, when you see, this is the intramural part or infundibular part, and number 2 is the narrowest part, isthmus. Number 3 is the ampulla. Number 3 is the ampulla. Number 4 is the, can you see the infundibulum? Here you can see nicely the thesis. Look at the fimbriae. You can see the fimbriae. This is the infundibular part. So these 4 parts are very important. Ampulla, where the fertilization takes place, is the most widest dilated part of the fallopian tube. Blood supply of the fallopian tube is uterine artery as well as ovarian artery. So the ovarian fossa is here, where the ovary is situated. That is called as ovarian fossa. The floor of the ovarian fossa is related to, if I reflect, you can see what artery is coming here. You can see here, see internal iliac is going below. So internal iliac, the external iliac forms a superior relation for the ovary. So if I put the ovary back, so look at this, if I put the ovary back, this is the ovary, and the ovary has the medial surface which is related to the uterus, and the lateral surface which is related to the pelvic side wall, and the upper pole is here for the ligament of ovary, and the lower pole is here for the ligament of ovary, and the upper pole is for the suspensory ligament which suspends. Somebody should suspend from the upper part, right. So this is the border called the anterior border for the mesoovarium. This area mesoovarium, and the posterior border is free. See, nobody is there in the posterior border, it is free. And then here on the floor of the ovarian fossa, see, this is ovarian fossa where it is situated. Superiorly it is crossed by the external iliac artery, and fossa, 3 structures, triple structures. Number 1 is internal iliac artery, number 2 is the obturator nerve. So number 2 is the nerve, obturator nerve is going here. Number 3 is the ureter. So 3 structures. Number 1 internal iliac, number 2 obturator nerve, number 3 is the ureter. 3 structures forming the ovarian fossa. Okay, ovarian fossa. Floor of the ovarian fossa is related to 3 structures. So if the obturator nerve is compressed, they will be having pain along the medial aspect of the thigh. So this is about the, if there is any ovarian pathology. And then next, rectum, they will ask about the blood supply of the rectum. Superior rectal artery is a branch of inferior mesenteric, and middle rectal artery is straight here, so it is a branch of internal iliac, and the third inferior rectal artery is a branch of pudendal. So this is about the rectum. So we have finished the uterus, parts of the uterus, body, and the cervix part of the uterus. And then next is the bladder. If they ask the blood supply, we should tell superior vesicle and inferior vesicle. Superior vesicle, the obliterated part is the umbilical artery, and the inferior vesicle is in females it is vaginal artery in females, right? So inferior vesicle. Then, so that's all about the cross. Here if they put the pin over here, you should answer this as the common iliac and this as the external iliac, which continues as a femoral artery. We have not yet done that. And if they put a pin over here, that is internal iliac. So internal iliac, they will ask the anterior division and posterior division branches.